Hi there. Today is almost the end of May, and part of my pursuit of living life to the fullest is that we need to keep this 76-year-old machine going. And as you can notice, this is the first video I'm making without glasses. So today I want to talk about cataract surgery and how it came about, and my fear or apprehensions, and my results, and on how it's becoming almost a miracle to me. So let's start from the beginning. And once a year I go for my regular checkup for my vision, and usually the vision changes a little bit. They sell you a new pair of glasses, and of course I have the glasses that are good for distance, they're good for seeing close by, in between, they're gradual, and then I have the fact that when I'm outside they turn into sunglasses, and vision is very important, so I had every bells and whistles on it. And when I travel, of course, then I carry the year before as a spare in case I would lose them or break them. And so something that when I first started to have glasses, it was tough for me to adjust. I was 50 years old. Up until then I had perfect vision, and you know, I rebelled to it, but then I got used to it like anything else in life, that you have to go with the flow. So when I went to pick up my glasses, I put them on, and there was a sign about, 10 feet away. And I asked the guy, I said, should I be able to read that sign? And he says, yeah, you just got new glasses. And I said, well, I can't. Well, let me see then if maybe we need to adjust them a little bit, come back in a couple of days and to pick them up. So I said, okay. And the thought came to my mind that when I did the examination, I never, when they say, is this better or is that better, which I always think they're trying to trick you, but none of them were really better. And when the doctor checked my eyes, he says, you have the beginning of cataract on the left eye, but it's too early to do anything about it. The insurance would not pay for it. So I said, okay, he knows what he's talking about. Well, after they called me and they said, your glasses are ready, and I still couldn't see, like for example, driving, I couldn't see the license plate of the car in front of me until I was directly behind it at the traffic light. I couldn't see the signs very clearly. I mean, I drive around here, so I know the name of all the streets, so I could guess by the length or by the, but it wasn't seeing very well. So I just paid several $100s for new glasses. So I kind of went back and said, I'm not happy. And they said, well, we have done everything we can do. Why don't you go and see an ophthalmologist? So I said, okay. Your mind starts running. There's something wrong with my eyes, and we're all made of flesh and bones, and we tend to be negative or think of the worst. And so of course I went to the same ophthalmologist that really has been helpful with Rosalinda's problem, where she had the two little arteries on the side of her eyes were blocked, and if that would not have been caught right away, it could have caused her loss of vision within a week or two. So that doctor took care of her, and so of course I went to see that doctor. I had to wait about a month and a half for an appointment. And in the meantime, as I was driving at night, I couldn't see as well, and it was not a new problem because those things happen gradually, but I was looking forward to the new glasses to fix these problems, and they weren't. The doctor had explained to me that the cataract is like a dirty lens, and you can put all kind of glasses in front, and nothing will clean that dirty lens. So So when I finally see the ophthalmologist, it says, you know, one thing is your prescription, and you have the correct prescription. The doctor gave you what you asked for. And one thing is the way you see. And we go by what you say. If you tell me that you cannot drive at night as you used to, and you cannot see as well, you cannot read the signs, and you know, those glasses really have not improved your vision, especially at your age, you could be falling, you could be having an accident, so the insurance will pay for a cataract surgery. So I said, great, let's do it. So they gave me all the options. And of course, it's covered by insurance, 100% my insurance, and Medicare, I believe, in general. But they said, if you want to have the vision for reading, middle distance, and long distance, then you have to pay for special lenses that are about $8,000, laser surgery, and so since I don't do much reading, I said, listen, if you could tell me that with these lenses I couldn't watch YouTube, then I would say, okay, fine, here's the $8,000. But if you tell me I cannot read books or things like this, you know, I hardly ever read, and because of my ADHD, laziness, lack of comprehension, whatever is the excuse. But when I need to read sometimes a label or something close by, and you know, cheap reading glasses do the job. So we scheduled it. I went for the pre-check appointment, the pre-op appointment, and I casually mentioned that I was having an angiogram, to where they found some blockage in my heart, and therefore they will go in with the angiogram, and then they might add a stent if necessary. So, oh, stop the presses. And I said, what's going on? He says, you cannot have anything having to do with your heart within 6 months, and therefore we have to postpone the surgery to November. Well, I was already set in my mind about going to Italy without glasses, seeing better than before, and so I was really disappointed. So after calling the doctor, the cardiologist, and getting hold of them, a couple of days went by, but eventually the cardiologist said, listen, your heart is not that serious. Do the cataract surgery first, and then this is my reminder to put my drops in. It's 1 o'clock. So let me stop this, and then I'll continue. So he said, do your cataract surgery first, and then we'll do the angioplasty after that. So I called back, and they scheduled the original, they put me back on the original schedule. And the only difference is that the doctor is on vacation, and they do it every 2 weeks, one eye, and then 2 weeks later they do the other eye. And because he's on vacation, I'll have to wait 4 weeks. Again, I was a little bit apprehensive about that, and to be fair, my reason for being the most apprehensive was the thought of somebody coming with a knife, especially since I got the cheap version, you know, maybe a steak knife, I don't know, to your eye, and then putting in a lens, and so I watched several YouTube videos, and it is not that big of a deal. It's routine, it's very safe, but you always hear that one person had this happening to them, or that person wasn't happy. So mentally you have to stay positive. The day finally came, and I went, and I had to wait about an hour in the lobby, because I think that's why when we go to the doctor we're called patients, because we have to have patience to just sit there. Anyway, eventually I go in, and they sit me down on a chair, they put a gown on me, they start putting all kind of drops in my eye. They asked me 10 times which eye is it, the left or the right. So of course I said the left. What's your birthday? What's your name? you know, and I appreciate it. I want to make sure they don't operate my knee or my foot. So the doctor eventually came in, he asked me again the same question, he put the initials, his initial on the left eye. So for what I paid, I'm glad I got an autograph. And then they put me on the bed eventually, and they, you know, blood pressure and everything, and the anesthesiologist comes in. And she says, do you have any questions? And I said, yes, I'm chicken. And she said, we like chicken. And I said, well, I'm chicken in the sense that the thought of somebody coming with a knife or a cutting tool to my eye, you know, it just, and she says, don't worry, I'll give you something that you will not remember anything. It will keep you awake because we might have to ask you to turn your pupil to the left, to the right, or something like this, but you will not remember anything. So, okay, fine, they moved me into the operating room, and they put a big tape to the bed or to something, so where I couldn't move my head, and I could hear conversation in the waiting in the middle room. Actually, I was hearing conversation of people that had the first eye done, and they were very positive. One guy says to the nurse, wow, you look a lot younger than before my operation. You look better. And another person said, Doc, you did a wonderful job. I just cannot believe what I can see. So that was a little bit of optimism, and kind of picked me up. So the moment I came out, which altogether in and out probably was 2-3 hours, and Rosalinda, of course, she had to drive me and pick me up. But I could already see even better, even though I had this plastic protection over my eye, which I had to wear for a week or so at night, just so that I wouldn't put pressure on it. But, you know, the following morning I drove myself back to the eye doctor. They checked my eyes, and it was less than 24 hours from the surgery, and they said that my vision had already improved from 20/40 to 20/30. 20/40 with glasses, 20/30 without glasses. Unbelievable. The next day I took a shower, and because they tell you close your eyes and don't let any soap come in, don't rub them, you know, I was kind of playing close one eye, close the other. And it was amazing to me on how the tiles of the showers, the colors were, with my left eye, were vibrant, were more, you know, I still am colorblind, but they were more clear, like if there was a filter that was removed. When actually, when I looked with my right eye, the same dullness, the same fog was there. So that was another positive sign. I since have been, you know, except for reading, when I am something really close, I need Rosalinda's reading glasses. I now have ordered some reading glasses that I can put in my pocket. They're foldable, flexible, and so I will have them whenever I need them. But I don't have to carry them around my neck or whatever. We'll see how that works. But they're very cheap. But again, this morning I went for the 1-week checkup, and everything looks fine. Of course, I draw myself. I'm wearing regular sunglasses now, and it has been a much, much better experience. So going back to the beginning, and what does it mean to live life to the fullest? Well, it isn't always being busy every moment of the day. It's not always look at me, look at what I've done this cruise, I've done these strippers. Sometimes it's the simplest things that really make you feel like your cup is running over. And the appreciation of better sight at 76, still say 75, next week I'll be 76. It just is a pleasure. And that will allow me to not always having to carry glasses and a spare. I bought some cheap sunglasses just to learn about it. I think it was like 3 for $15 from Amazon. You know, was in about another pair first. I looked like a tank. We returned those, and so it's a new adventure. It's a new phase, but what a gift. Cannot wait for the second eye to be done, because they say that the optimal vision will be achieved about a month or so after both eyes have had the surgery and the healing has completed, and therefore I'll see the best. So again, I'm very thankful, very appreciative, and again, I don't know how else to say. Happiness or contentment sometimes is in the simplest things, and I never thought that being able to see more clearly would be possible anymore for me as I'm getting older, but instead it looks like we are reversing the clock. So until next time, ciao.